Hello guys, welcome back to my YouTube channel Swastik Dental Academy. Myself Dr. Vikas Kaushik, oral and maxillofacial surgeon. So as we already know that dental implants are the future of the dentistry. So before placing an implant, we should know all the basics of the dental implant. So from today, I am going to start a series of videos in which we will discuss about the basics of dental implants. So guys, in our first video we are going to discuss about history of dental implants, different type of implant materials and its classification, parts of dental implant and biological parameters for implant acceptance. So let's start with this video with the history of the dental implant. History of dental implants starts from 2000 BC when ancient Egyptians used shells and ivory to replace missing teeth. Then in 600 BC, ancient Mayan used false teeth made from shells implanted into lower jaw. In 100 to 200 AD, Roman dental work a fixed processes you can see. In 1940, Dell proposed intramucosal implants or button implants. Then in 1951, Denmark demonstrated that under controlled conditions, titanium could be structurally integrated into living bone with a high degree of success. Then in 1965, first titanium roots are implanted in a patient. Then in 1967, Linko's blade vent implants were discovered. Then in 1970, Roberts Ramus frame implants were introduced. Then in 1981, Schroeder and Lederman introduced titanium plasma spray. Then in mid-80s, Dr. Stig Hansen demonstrated that microstructure surface improve load distribution and helps retain crestal bone. Then in late 90s, all-on-4 implant technique was introduced. Then in 2011, Thomann Medical introduces hydrophilic surface which speeds early osseointegration. So now we are concentrating on the term osseointegration. Osseointegration means os means bone and integration means being contained. So according to Brenmark and his co-workers in 1989, osseointegration is defined by total integration of dental implant in bone, especially when the bone is healing after the trauma of implant placement in bone. It is also called as ankylotic bone. So now we come to classification of dental implant materials. So we have divided it according to biodynamic activity and chemical composition. In biodynamic activity, we have biotolerant, bioinert and bioactive materials. And according to chemical composition, we have metals, ceramics and polymers. In biotolerant metals, we have gold, cobalt, chromium alloys, stainless steel, zirconium, niobium, tantalum. And in biotolerant polymers, we have polyethylene, polyamide, polymethyl methacrylate, polytetra, fluoroethylene and polyurethane. In bioinert metals, we have commercial pure titanium, titanium alloy. And in bioinert ceramics, we have aluminum oxide, zirconium oxide and polyether ether ketone. In bioactive ceramics, we have hydroxyapatite, tricalcium phosphate, tetracalcium phosphate, calcium pyrophosphate, fluorapatite, brushite, carbon silicon. Guys, as we know that titanium is highly reactive metal. So when it is exposed to the environment, it undergoes oxidation and it forms around 5 to 20 micrometer thick layer of titanium oxide, which is almost totally inert in nature. Titanium in its implanted form offers considerable strength to withstand occlusal or functional load. This, along with osseointegration, makes it closest to the ideal implant material. Titanium implants are either plasma coated or surface etched that will further help in osseointegration. Now we have a classification where we have classified dental implants on the basis of method of placement, on the basis of number of implants used, and on the basis of density. On the basis of method of placement, we have two one stage and two stage implants. On the basis of number of implants used, we have one piece implant or two piece implant. And on the basis of density, we have hollow or solid dental implants. We can also classify dental implants based on shape and form. For example, root form implants and blade implants. In root form implants, we have solid tapering type, cylinder type, pin type, screw retained type, basket type, hollow cylinder type. And in blade implants, we have conventional blade design and vented blade design. Based on surface characteristics, we have titanium plasma sprayed coating, sandblasting surface etching, laser induced surface hardening, hydroxyapatite coating. Based on implant tissue interface, we have osseointegration or fibrointegration. Based on foundation, we have implant supported or implant assisted. Based on mode of retention of prosthesis, we have removable or fixed. In fixed, we have screw retained or cement retained. Now we will discuss the parts of implant. First of all, implant body, its cover screw, healing abutment, copings, and transfer copings, indirect or direct, and then we will discuss about the implant analog. Guys, this is implant body. It is made up of either metals, non-metals, for example, titanium, zirconium, stainless steel, and it has also various shape and forms, for example, tapering type, cylinder type, screw shaped, either it is surface etched or plasma sprayed. After placement of implant in bone, it get its primary stability through osseointegration. Guys, on the left side you are able to see the cover screw. Cover screw is a cover which is placed on the top of the implant. It helps to prevent bone, soft tissue or debris from invading the abutment and connection area during the healing phase. On the right side you are able to see the gingival former, or you can say healing abutment. Healing abutment or gingival former extends the implant above the soft tissue and it results in development of permucosal seal around the implant. As we can say, it is also called as healing cap or abutment, healing abutment, and it is used for initial soft tissue healing. Now we will discuss about the abutment. Abutment is the portion of implant that supports or retains prosthesis or implant superstructure. There are three main categories of implant abutment. First of all, an abutment used for screw retention on left side, then an abutment for cement retention, as you can see on right side, and the third type of abutment is the abutment that is used for any kind of attachment. Abutment are further classified into straight abutment or angled abutment. Straight abutment, and as you can see on the left side, and angled abutment on the right side. Abutment can be fixed to the implant body with the help of an abutment screw. After placing an implant, an impression is necessary to transfer the design and position of implant or abutment to a master cast for prosthesis fabrication. It is usually of two types, indirect or direct. Indirect is also called as closed tray impression and direct is also called as open tray impression. So we will discuss in detail about these impression techniques. I will make separate videos for both of these techniques, open tray and closed tray, in future. Before understanding these impression techniques, first of all we have to understand the transfer coping. What is transfer coping? It is used to position an analog in an impression, and it is defined by portion of implant that it transfers to the master cast, either implant body or abutment transfer. So these are of two types, indirect or direct transfer coping. So first of all we'll discuss in detail about Indirect transfer coping. Indirect transfer coping uses impression material with elastic property, and this coping is screwed into the abutment or implant body and remains in place when set impression is removed from the mouth. This coping is parallel sided or slightly tapered to allow ease in removal of impression. It often has flat sides or smooth undercuts to facilitate reorientation in the impression after it is removed. Now we will discuss direct transfer coping. It consists of hollow transfer component which is often square and a long central screw to secure it to the abutment or implant body. After the impression material is set, the screw is unthreaded to allow removal of impression from the mouth. Impression material should have rigid properties and eliminates the error of permanent deformation because it remains within the impression until the master model is poured and separated. Now we will discuss about implant analog. Implant analog is used in fabrication of master cast to replicate the retentive portion of implant body. So after impression is obtained, corresponding analog is attached to transfer coping and this assembly is poured in stone to fabricate the master cast. There are four biological parameters for implant acceptance. First is material biocompatibility, in which titanium is the most frequently used dental implant material. Then implant design, cylinder foam is the most commonly used. Then implant surface, it is either plasma sprayed or surface as to increase its osseointegration property. Then host sites, the site where either maxilla or mandible which is receiving the implant. So guys, please like, share and comment on this video, and see you in the next video where we will discuss in more in detail about the dental implants. Thank you.